Good morning. It's a Monday. It's March the 27th, and we're here at a symposium for advancing research data management and sharing in biomedicine. So just check you're at the right place at the right time. And it's my pleasure to introduce Peter Tanuseputro, who's going to welcome us all. Here's the next one. Yeah. Do I have to use this?
Thank you. Thanks, David. And thank you for the kind invitation. The program looks fantastic. Minus you having to listen to me for opening remarks. So it looks fantastic. Yeah, when I was asked to give this opening remarks, I wondered, what can I actually say that's actually important? And I'm not sure. I think you'll see. I think what I've kind of gone through, essentially it's an overview of the data age that we live in, and the opportunities and challenges that brings. Okay, and I'll just walk through what we do ourselves as health services researchers in using the data and really bringing it to life, and talk about some of those challenges that I think you'll be talking about throughout the day. Okay, so disclosures, really nothing. I am part of the Ontario Health Data Council, and some of these slides are borrowed from that council that I belong to. Just to give you an idea of what we do in our program of research. So I'm a health services researcher. I'm a family physician and a public health physician by training. About 80% of my time I do health services research, and the common theme across all our programs of research is data, essentially. So I worked at ICS, what used to be the Institute of Clinical Evaluative Sciences, and we used data from ICS, but also across the broad range of data holdings. Okay, so I thought I'd start us with this. Obviously we live in an age of data, and in healthcare, what has really transformed the amount of data that we have and the types of data that we have is, this transition from analog to digital, right, in healthcare. So I remember, I think it was about 10 years ago when I finished my residency, when we were practicing and when we were training, we still had paper charts, right? I don't know, some of you are clinicians. I don't know if you remember those paper charts. I remember them quite distinctly, right? And I still can't read any of my handwriting because it's all scribbled, but we've transformed, right? I remember it was 10 years ago that, we were starting to get incentives to come on board, right, to EMRs and to bring that data in a digital form. And so what that has brought, is obviously an increasingly data-rich environment. So more and more we're collecting and linking data in healthcare. And this is the sort of data that we use ourselves, routinely collected health data. So we have health administrative data, so data that's collected in the process of administering healthcare. We have more and more now lab and imaging data, socio-demographic data, environmental data. So I always give this example at ICS or in the research that we do, that every point of contact in healthcare is recorded, right? So if you imagine, I always give this example, if a patient who has an OHIP card, they see me for an abdominal pain, that's recorded, right? They saw me, they had abdominal pain. I send them to the merge, that's recorded, right? They get admitted because, they might have appendicitis, that's recorded. Surgery for appendicitis, recorded. Discharge to home care, long-term care, wherever they go, recorded. Medications, recorded. And all of that is a linkage, right, through the person's journey. And that really brings, very, very strong, ability for us to examine the patient journey and how to improve that journey. And more, it's not just about health data, right? We have now socio-demographic data and environmental data, for example. So I'm an immigrant. Sometimes I start my talks giving an idea of who I am. So I immigrated from Indonesia, 1986, and that's recorded. Okay, so we actually linked data from the CIC, citizenship, or I think it's called the IRCC now, Immigration Refugee Citizenship Canada. And we linked that to ICS, so we were able to find out that yes, Peter immigrated from Indonesia, family sponsored, et cetera, et cetera. Okay. And that's really powerful data that can give us information about not only our healthcare, but about who we are. And more, we're starting to collect and link primary data collection, right? I know not all of you do health services research, but more and more we're linking study data, survey data, prospective cohort data right into the mix, right? And so we have this great data ecosystem that really gives us a full picture of what's going on. And for primary data collection, it's only a subset of the population, right? A lot of the data that we use in the health admin data is population-based. But for a subset of that population, we can really start telling in greater detail about the exposures and outcomes of these individuals. So this is just an example of a published paper that we just released that shows you all the linkages between the healthcare sector. So this is just a study looking at the last 100 days of life of a patient with cancer, and it shows you the number of days that people spend in each healthcare setting. Okay, so it gives you an example that we really can get that wholesome picture of the care and the care experience of the patient. So here you can tell that the majority of care is spent at home without home care, but a lot of care is provided in an emerge at home with home care in a hospital acute care setting. Okay? So just an example that it really is powerful and gives you a good picture of the entirety of the healthcare experience. Not only are we obviously living in an age of data, but we're having increasing capacity to handle this data. I think we all know this. There are more data solutions and higher computing power that enables higher and more advanced analytical methods, obviously AI, machine learning, and it also helps us to incorporate more complex data. So before genetics data, imaging data, personal wearable data from your, from your iPhone or your iWatch, before all of that was quite complex to incorporate, right? We don't always use AI machine learning, but with this kind of data, when it's unstructured, huge streams of data, longitudinal data, we try to incorporate using more advanced analytical techniques, where in the past, with traditional statistical techniques, it's more difficult, right, to do. With opportunities, obviously, there are challenges. So I think I brought this slide from Bob Breed, who was part of the OHDC. So currently, our care is quite not integrated, disintegrated, right? On the left-hand side there, right? Nothing is really connected. Some things are connected in places like ICS, but not in real time in any meaningful way, right? And the state that we like to get to is this right-hand side. We have integrated and accountable care. And what's really prominent there is that the patient, okay, the patient is at the center of that integrated care. Ideally, all the feedback, all the information, and all the data that we get from different sectors, including primary study, will feed back into the patient. And this is the vision that the OHDC and the Canadian networks have in terms of trying to integrate data. So what do we need to achieve this? Well, we need, first of all, clinical integration, right? So right now, clinical care sometimes is fragmented. We are getting better, but we need care that's continuous and coordinated across health sectors, right? So as a family doctor, for example, my patients who receive home care, we use home care data quite a bit in our research. I don't see any of that data, right? They conduct 1 hour, 2 hour assessments. Does that get fed back to me? No, not in any way, right? When patient is in hospital, does that data get back to me? Yes, actually, it's getting better, right? And sometimes in real time, but sometimes there's a real lag, to it. And once it gets to me, it's not integrated into my EMR, and so we don't get quite good coordination across the sectors. We also need data and digital integration. Obviously, we need leadership, champions like yourself, and management across sectors, and we need financial integration. So too often is finances siloed, right, in healthcare. So hospitals have their bottom line. They need to protect their bottom line. A lot of the research that we do is actually saying that, wait a second, you should be investing in more community care, more in primary care. But if you invest in primary care, you invest in community care, what does that do to the dollars at the hospital level, right? There's no financial integration. It's getting better through things like Ontario Health Teams, but we're not quite there yet. And this is just a reminder that I've been talking about integrated patient care, but obviously many of you are in research, in analytics, in data science, and all of that feeds data into the different realms, right? It's not just about providing individual clinical care. It's about understanding disease, advancing treatments. Many of you are in that realm. patient safety, planning healthcare services at macro level, and all the way up to health system innovation. And all of that is, really, really powered by that health data that we have access to. So I don't know, how many of you are aware of the pan-Canada health data strategy? Some of you? Okay. This podium doesn't have like a place to hold coffee, and I have to have my coffee, so excuse me. But yeah, so fall 2020, I wonder why, right? They felt the need to have a pan-Canadian health data strategy. Something called COVID came by, and they realized that the data was not that integrated, right? And people were scrambling for access to data and real-time data. I think that's what people start to realize, that we don't have access to real-time data. Everything is flagged, everything is delayed, and pandemics don't move in 3-month cycles, right? They move on a daily basis. So it received basically federal, provincial, and territorial support in the fall. There was an expert advisory group that was formed at Christmas, and they've actually produced already 3 papers. And they have a Canadian health data charter that I think is actually quite useful. And I'll go through it very quickly here. So what is it on? What does it do, the pan-Canadian health data strategy? Well, it focuses on modernizing collection, sharing, and interoperability. That's a word that everyone's using, but essentially, how can we build data systems that talk to each other, right? And talk to each other in an automated way, not in the kind of forced kind of way. A big part, and this has been discussed during COVID over and over again, a big part of the issues of data is that there are many data custodians in our system, right? And privacy laws, confidentiality laws, all of that is really hampering sometimes the sharing of data. And it's not just about streamlining updating data, the privacy laws, but it's also clarifying privacy laws. So when I speak to the privacy officer in Ontario, often, she would say that, yes, that's one way to interpret it, but that really is not the way that you should interpret that privacy law. And most people take a cautious protectionism sort of view on privacy laws. No surprise, but the pan-Canadian health data strategy tries to, open up that discussion and really kind of give case examples of what it means, the implications of privacy laws. And the last thing is, obviously clarifying accountability and data governance for people who actually have the data. So what are the responsibilities of these data custodians, and what exactly can they do and cannot do? Barriers, I'm not going to go through it. So the barriers that, and all of this, I think, is going to be themes throughout the day, right? There are many barriers to actually having an integrated data system, right? Risk aversion, lack of trust, some of those, pick your favorite, right? There's a lot of barriers that we face here in sharing data and making that data come alive. Okay, so this is a charter, and I'm not going to go through it, but it has lots of goodies. So addressing each of those barriers, what are the concepts that we need to adopt to really bring the data to life? So the first one I talked about, person-centric health information design. So everything going to the patient. There's things about privacy and security. Number 4, I really like, timely, accessible, and meaningful comprehensive health data to individuals. So real-time data, and not just reams and reams of data, but process intelligent data that really informs clinical care. And at the heart of this, so that's a lot of bullet points, but what is our vision for what we can do with this data? I don't know how many of you have heard of this concept, but it's gaining quite a bit of traction. This idea of creating learning health systems, right? And in the charter, in the OHDC, we talk about person-centered learning health systems. So not just a learning health system at the system level, but also at the person level. And I'm gonna only speak 2-3 more minutes, but what exactly is it? Rapid learning health system powered by real-time analytics. So it's basically using data to improve the care that's provided. And I'm gonna show you a concrete example, but this is the iterative loop that we have in the learning health system. I don't think you can really see it, but in detail, sorry about that. But basically you collect data, use the data, you feed it into clinical practice, you evaluate what's happening at clinical practice, and clinical practice improves, right? And feeds that back into the data system. So that's a learning health system. And it's not just at the individual level, it's also at the macro and the meso level. So at the provincial, federal levels, at the meso level, OHTs, for example, and then at the micro level for clinical care. These are the key elements of learning health system. So interoperability, patient-reported experiences, longitudinal data across sectors, the capacity to link all sorts of data, not just health data, the capacity to analyze the data, and the capacity to share the data. Okay, and I'm just going to end by giving you an example, okay, of what we do. This is the Center for Individualized Health. It's something that we created, and this Center for Individualized Health basically takes a data science approach and to transfer big data into knowledge and tools that help people make better decisions about their care. Okay, just a lot of verbiage there, but essentially this is an example of one of the tools that we created, the Respect End of Life Calculator. And essentially it takes data from home care data and spits us life expectancy so that people can get care and make decisions and have discussions that are concordant to their prognosis. Okay, so if you have 3 months to live, there's very different things that you should be doing and talking about than if you had 12 months to live. And this is just a walkthrough of the website that we have. I'm not going to go through it because of time, but this is the learning health system that we ourselves are trying to create within our lab. Okay, so this is us, the investigator working with the analysts and the web developer. And what we do is obviously create predictive algorithms. And this predictive algorithm is really powered by the data that's collected on a routine basis. So in this case, home care data. And from there, we have an application that goes to the patient. So that's a Respect tool, for example, online. And we have applications that's fed back at the health data collection level. So we use the data that's collected, we build predictive algorithms to transform that data, right, into meaningful data. And then we import or export our predictive algorithms in the backend through things like APIs at the data collection level, right? And that gets fed back, obviously, into clinical care or patient care. And we have a continuous cycle, and that continuous cycle goes back into our predictive algorithm development. So here we have a mini learning health system where we have data collected at the front lines, processed, fed back into clinical care. Okay, so that's one example that we have. So these are just some of the news stories that came up. Yeah, so what our team is trying to do is really use big population, big data to transform data into tools that can inform clinical decision making. And again, what we really try to do is automate risk prognostication in real time, right? And as it's being collected at the front line, so we create a learning health system that's not just using stale data. Okay, and this is the vision. I think there are many elements of the talks throughout the day that talk about the roots of a person-centered learning health system. Interoperability. I know there's going to be a talk on indigenous data and sovereignty. And essentially, I think there are many components to data, but I think it's usually helpful to think of it as a, as an ecosystem that contributes to the learning health system for the ultimate goal of improving patient care. Okay, that's it.